My name is Dr. Navneeth Kumar. I'm a consultant orthopedic and spine surgeon at Athreya Hospital. And today we're going to be talking a little bit about osteoporosis to educate the public better about this condition. So, as per the medical literature, osteoporosis is defined as a systemic skeletal disorder which is characterized by a reduction in the bone mineral density and a microarchitectural deterioration of the bony tissue, which leads to increased porosity and brittleness of the bone, therefore increasing fracture risk. So all these are complicated medical jargons, and to basically simplify it, osteoporosis is nothing but a condition where your mineral content in your bones all over the body are reduced. So because of this, your bone basically becomes brittle. It's not as hard as it is supposed to be, and therefore it breaks much easier than it should. So this is the basic gist of osteoporosis. Osteoporosis begins with osteopenia, okay, which is the very first stage of osteoporosis, where there is a reduction in the bone mineral density, but the bones are still strong. They are not weak enough to cause brittleness and pathological fractures. So osteopenia can be detected on a simple DEXA scan, where you get something called a T-score. I'll be talking about this in further detail in the subsequent videos. But a score between -1 to -2.5 is indicative of osteopenia. It is silent. There are no symptoms of osteopenia, but it is a good indicator that the patient has appeared to you early, and we can manage them so that they don't progress further to osteoporosis. And then the next stage, they progress on to frank osteoporosis. So when a patient presents to you with osteoporosis without any fractures, that is called preclinical osteoporosis, and the DEXA score will show a T-score of less than -2.5, which shows it is significant and the bones are brittle and they are at risk for fractures. And of course, the very last stage is the manifest osteoporosis, where the patient comes to you with an osteoporotic fracture. So there it's obviously too late. The patient is already having a pathological fracture and they need to be treated appropriately. So these are the different stages of osteoporosis. And now coming to the third sub-question, that is what is the risk factors for osteoporosis. So this is important for the general public to know, so that we can identify the people who are at risk and treat them adequately. So the number one risk factor in osteoporosis is ladies who are post-menopausal. Have this between 45 to 50-year-olds. They are at high risk, where they have a drop in their estrogen levels, and there is also a generalized decrease in their intake of calcium and vitamin D rich foods. So they are the number one risk factor group. Okay. Second, of course, are any individual, be it male or female, above the age of 70, they are invariably at risk for osteoporosis. And patients who are having the habit of smoking or alcoholism, they are at higher risk. And ladies who attain menopause at a much earlier age, maybe at around in the age of 40, they are at a higher risk for osteoporosis. And any patient taking steroids for a prolonged period of time, for whatever reason, be it rheumatoid arthritis or inflammatory bowel disease, etc. So they are at an increased risk of osteoporosis. And lastly, patients who are taking certain drugs, like for example anticonvulsants, patients who are epileptic disorder taking anticonvulsant drugs for a long period of time also are at risk for osteoporosis. So by knowing these risk factor groups, we can target our screening of osteoporosis to these at-risk groups. So this is important for people to know, so that there's no panic among people that everybody is a patient. We need to identify these are the risk factors and target our screening and treatment towards these at-risk patients. A lot of people don't know about osteoporosis, and many a times we see elders presenting to us with a fracture osteoporotic fracture. So, which obviously means that they're too late. They didn't know about the disorder, they didn't take any treatment, and they have ended up as patients with fractures. So, it is very easy to detect it. Okay, a simple screening test for osteoporosis is called DEXA. DEXA. The scan it stands for Dual Energy X-ray Absorptiometry. So, it is a simple, non-invasive, and a quick scan to detect osteoporosis. It can be done at multiple sites in our body. There is a peripheral DEXA, then there is a central DEXA. Central DEXA tends to be more accurate, okay, and they measure the bone mineral density from the lumbar spine or the hip. And the results of DEXA scan is classically given in the form of T scores. So a T score of minus 2.5 or less is indicative of osteoporosis. A score between -1 to -2.5 indicates osteopenia, and any score more than -1, that is indicative of a normal patient. So this is how you can get yourself screened for osteoporosis if you belong to the risk groups which I earlier mentioned. And how frequently should we do this DEXA scan? Should we do it every day, every week? No. So those patients who have had an initial DEXA scan indicating they are normal, they don't have to repeatedly go and get themselves screened. But those who are actually detected with osteopenia or osteoporosis and have sought out treatment with their physician or an orthopedician, they need to be regularly scanned for DEXA. The ideal interval will be around 6 months. Okay, so it's a biannual checkup because that indicates the T scores on the repeated subsequent scans will tell us whether the treatment is working or not. So that is the frequency in which you should get your DEXA scan done. Question. So prevention is always better than cure. So we need to know how to prevent osteoporotic fractures. So the three main pillars of prevention of osteoporosis is diet, exercise, and of course any augmentation with formulations like vitamin D and calcium. So I'll be talking briefly about the diet. So our diet should consist of, depends if you are a vegetarian or a non-vegetarian, of course. For non-vegetarians, a rich source of vitamin D and calcium tends to be salmon, mackerel, tuna. These are three very important seafood sources, okay, which are rich in vitamin D as well as calcium. But for the vegetarians, of course, they have to focus. The diet should have more of collard greens, green leafy vegetables like your palak and your methi, okra, and even cabbage, and milk. Of course, milk and egg are very rich sources. So milk also we can focus on low fat milk, cheese, and yogurt. All these are some of the very rich sources of calcium and vitamin D available for vegetarians. Coming to the exercise. Now, exercise, there needs to be a perfect balance when it comes to exercise. Doing too less is wrong, doing too much is also very bad. So, the optimal exercise should be limited to 3 days in a week. And the exercise should consist of basic resistance training, which includes use of your your elastic bands or low weight dumbbells. Okay, walking is a very good exercise, which I think is very easy to follow. And thirdly, which I would stress on for patients with osteoporosis, is swimming. So swimming is a brilliant exercise. The moment the patient gets into the water, the gravity is eliminated. So the load on our bones is eliminated. So swimming is an excellent exercise which can strengthen your bones and muscles without increasing the risk of a fracture during your exercise. So if you can dedicate maybe 3 to 4 hours of swimming a week, it would do great. And patients with osteoporosis have a tendency to develop a kyphotic spine, where the spine tends to get hunched. The patient has a more hunched posture. So swimming can even correct that. So I would advise these three things: resistance training, walking, and swimming as three main exercises for patients who are diagnosed with osteoporosis or those who are at risk, who are yet to be diagnosed. Third pillar in the prevention of osteoporosis is taking supplements. So what supplements do we take? Do we just buy some multivitamins from the market? No, the focus should be on calcium and vitamin D. Elemental calcium of 500 mg is recommended daily allowance, and vitamin D can be taken in the form of once weekly formulations of 60,000 units. So both of this has to be taken for a minimum of 3 months to bring about any meaningful improvement in bone mineral density. So I think these are the three main ways by which one can avoid or prevent osteoporosis. So osteoporosis is not just a reduction in bone mineral density. It is a systemic disorder which has an impact on the patient's overall health. So the most important point here is, of course, the reduction in the bone mineral density that would result in an increased frequency or risk of fractures. So these fractures I'm talking about in osteoporotic patients, they need not happen from a high velocity trauma. Even a simple fall at home can result in a fracture. A person can trip and fall on an outstretched hand and they can fracture their wrist, or they can have a trip and fall in the bathroom and they can break their hip. And in some cases, it doesn't even have to be a fall. A patient can be doing their day-to-day activities and can break their bone. Like a simple getting up from a chair can also result in fractures. So that is one thing. Second important impact on overall health is that there is chronic pains. Patients with osteoporosis usually present to us with diffuse back pain or knee pain or ankle pain. So that tends to increase morbidity, reduce their mobility. So that is another impact. And thirdly, mental health. Yes. So patients with osteoporotic fractures in particular are debilitated, they are bedridden, and they are in a lot of pain, and they are not able to do their day-to-day activities. So they feel that they are no more part of society. They are, they have a lot of depression. Okay. So mental health issues are a very important cofactor in patients with osteoporosis. That is another impact. And of course, the fourth important impact is a progressive loss of height and a stooped posture. So patients with osteoporosis, their vertebra, that is their spine, becomes very soft and brittle. So they tend to develop these wedge fractures at multiple levels, which results in a very stooped, unhealthy posture, and it reduces their height as well. So that leads to further disabilities in their day-to-day activities. They're not able to do some of their activities which they used to do when they were young and healthy. That is another aspect. And malnutrition. So patients with osteoporosis are unable to feed themselves on time. They're not able to cook for themselves. They need help. So that itself is contributes to malnutrition in these patients, which results in reduction in their bone mass and as well as their muscle mass, making them even more fragile. So that is another point. Then social isolation. So this is a very important aspect of osteoporosis. As I said, this is more commonly in elderly patients above the age of 60 or 70. So these patients, they need extra care. They need a full-time nurse to take care of them with their day-to-day activities, which may not be possible at home. So these patients are often admitted in nursing homes or old age homes where they're taken care of. So there's a certain element of social isolation that these patients face. So that is another impact of osteoporosis. And lastly, economic burden. So a patient has a trip and fall and they fracture the bone. Obviously, they need treatment. They need to approach the hospital. Some may even need surgery, which obviously entails a lot of cost. So there is an inherent economic burden which comes along with osteoporosis. So those are some of the impacts on overall health. So the most important complication of osteoporosis is the fragility fracture or the osteoporotic fracture. So patients with osteoporosis, they don't have to have a high velocity trauma to fracture their bones. It's already brittle. So their bones get fractured even with simple minor traumas which can happen on a day-to-day basis. In some cases, patients can break their bones even without any trauma, without a fall. The day-to-day activities like simply getting up from the chair or even sitting down a little hard can also break their bones. So one classical example of such a complication we are going to show here is an X-ray of a patient who is currently in our ward. It is a 75-year-old lady who presented to us with a severe pain and swelling in her wrist. She had a domestic fall at home. She was walking from her kitchen to the hall, and there was a carpet on which she tripped and fell, and she fractured both her radius as well as the ulna. As you can see here in the X-ray, both her distal radius and ulna are fractured, and the bone quality also is quite poor. So this is a classical osteoporotic fracture in a 75-year-old lady. So obviously the patient had a lot of pain, swelling and deformity, and we had to operate her. So this is the X-ray of the same patient after surgery. So we have fixed the fractures here with plates and screw for the radius and a K-wire for the ulna. So this is a classical complication of osteoporosis. So, misconceptions in osteoporosis, to be very honest, there is no misconception, rather there is a lack of information. Patients don't know about osteoporosis, and that's understandable because it is a silent disease. It is called a silent killer for a reason. It doesn't give any obvious symptoms. If you have fever, you obviously approach a doctor, you take some medicine. Osteoporosis is going to be silent. It doesn't cause any symptoms in its earlier stages, at least. So that is the reason why majority of the population remain uneducated about it and don't approach the doctor until it's too late. So I think the most important thing we can do from the medical fraternity to non-medicos and normal civilians is to educate them about osteoporosis and so that the public know that who are the people who are at risk, so that they can identify themselves and approach medical professional for help. So I think that is the best thing we can do for patients, like this video.